Good morning, good afternoon, good evening, whatever time you're looking at this. We're going to talk about psychological disorders today. In your textbook is chapter 13. So, mental health workers actually defined psychological disordered people when they show signs of deviance, distressfulness, and dysfunctional. It is also, these things are diagnosed through what's called the DSM-5, the Diagnostic Statistical Manual of Mental Disorders. Now, it's good for people to understand and know what psychological disorders look like in order to be able to treat it. So, in reality, it does label an individual, and for some, those labels can be unfair because people will be stigmatized. And for others, it could be a crutch that's used to not necessarily accept responsibility for their behaviors. So, we have several different aspects of psychological disorders. We're not going to cover all of what's on the PowerPoint slides, but in one of the slides, it shows a young man with tattoos everywhere. And then he has the thing through his nose. Now, most of the time when we would see someone like that coming towards us, well, I don't know about you, but the first thing I'm going to think is, that's a freak. But that's his way of expressing who he is. And for most people, tattoos mean something. Each tattoo has a story. So maybe what's in his face is a story of some sort that he can relate to. But would we consider that a psychological disorder? Well, you would say, no, probably not. Well, from what I understand, they say that tattoos are addictive. Like people that have tattoos everywhere will say that they're addictive. Like when you get one, you want another one. I beg to differ. My son is behind the camera. Alfonso, how many tattoos do you have?
One.
What age did you get it?
I don't even remember. 21? No. 25?
Yeah.
Something like that.
Only one. And even though the circumstances changed from the time that that tattoo was received, he refuses to go in and fix it because of the pain. So I guess he and I be on the same page because I have two. And I only have two because I was getting the one to make him get the first one. So it is a form of addiction. So is addiction an addictive personality? Is that a disorder? Yes. So it could be classified as a psychological disorder. Now, there are a lot of different models, but we're not going to go over those. What I want to talk to you about, we're going to start with anxiety disorders. And with anxiety disorders, it's a very broad area. So let's look at panic disorder. Nope, I'm sorry. Phobias. So phobias are, or it is an anxiety disorder that's marked by a persistent, irrational fear of a specific object, activity, or situation. So, since I know most of you are going to be watching this on your own time, so I'm talking directly to you. What is your phobia? Now, what I want you to do is I want you to write that down, and that's what you're going to put in for your part of your discussion for this week. So what is your phobia? And if you don't have one, say I don't have one. But because we're not sitting in the physical class, no one is going to know what that is except for me. So I can tell you mine. Mine is claustrophobia. That's a fear of enclosed places. I used to couldn't even get on an elevator. You know the elevator over there in Thurkill? One time I got on it, and then several other students got on it. And you know they were a little heavy. And I'm sorry, my son breathing behind me. Anyway, and the elevator actually took like a dip down. So I had them open the door. And I'm telling them, y'all need to take the stairs. But anyway, I took the stairs. So for years, I took the stairs. I would not get on that elevator. And I think I stopped getting on the elevator probably in 2009 or so, and haven't gotten back on it since. So I actually don't get on elevators, or I didn't until I had to be submerged in it. I had deliveries where I was on the 21st floor. Are you going to really walk up 21 flights of stairs and take 2 hours to get the people their order? Or are you going to get on the elevator? So I got on the elevator. And the first time I took it, I was panicking on the inside. So a phobia is something that it's irrational, because elevator could stop, but 99% of the time it doesn't. So now, the building that I work in, I literally can get on the elevator. And the elevator is old, and I know it's old. Like it's got carpet on the wall. But I get in that elevator without a problem. So in order for me to have gotten to a point where I could do it, I had to submerge myself in it. So that's actually one of the treatments that's used for people that have phobias, is they take you to whatever that phobia is and they put you in it. You are submerged in it. Some people can take them deeper into their phobia, while others, it helped them to realize that it's irrational and they can move on. So if any of you identify that you have one, I would tell you to try taking baby steps to change it. It may or may not help, but at least you tried. So, how many of you heard of social phobia? Well, you guys probably wouldn't think of this, but when you go on your sites, and the one thing that you're looking for is you're looking for people to like you, right? You want those thumbs up. Am I right? Well, social phobia are individuals that has a fear of being scrutinized by others. So, and what it says is shyness taken to an extreme. So let's be honest. How much would you like going out in public if you felt that you were going to be scrutinized by others? And every time you walked out, you were going to be scrutinized. You would probably not go out. Now that particular phobia is called agoraphobia. And that's the phobia of actually going outside. Like they don't go outside. And now with the fact that you can have everything delivered to your door, they don't necessarily have to go outside. There are specific phobias, such as being afraid of certain kind of animals, insects, fear of height, fear of blood. I had a student one time who was terrified of midgets. Not dwarfs, but midgets. And I normally don't laugh at anybody's phobia because I know how serious they could be. But there was one that came around her and she took off running. And I was like, what? So when I saw her again, I was like, what's going on? She said, well, I'm scared of midgets. And I said, why? She said, I don't know. but I don't like midgets. So, I mean, that's one that I would not submerge her in, because the look that was on her face before she started to run was absolute fear, absolute panic. So, you know, there are some of the ones that we have, they're crazy, but you can look them up and see the different ones that's out there. So the next one they talk about is panic disorder, which is some of the things we just talked about. Now, panic disorder or a panic attack. Let's go with a panic attack. A panic attack is something that feels like a heart attack. It resembles a heart attack. Your blood pressure rises, your heart starts to beat faster, you have a difficulty in breathing, and you literally feel like you're having a heart attack. But in reality, it's a panic attack. And normally when I've only had one in my life, and the one that I had, I felt like I had to go outside. I literally ran out the house. And when the air hit my face, I was able to get it together. Well, that was a one-time incident. Well, there are individuals who have numerous amounts of panic attacks. And in order to get the diagnosis of panic disorder, that those individuals, the fear is having another panic attack. So the more you fear it, the more it becomes pervasive, and you end up with the actual diagnosis of panic disorder. So that one, I would tell you, if you suffer from it, you probably would need to go and talk to somebody, because it can actually be deadly. So let's talk about OCD, obsessive compulsive behavior or disorder. And this is characterized by unwanted repetitive thoughts. Those are obsessions. And or actions, which are compulsions. Obsessions may be concerned with, it could be that you're concerned with dirt, germs, or toxins. The compulsions may involve excessive hand washing, checking the doors or locks, or appliances. So, my question to you is, can you be obsessed about something and not be compulsive? I know you're thinking about it. Okay. Can you have compulsions and not have obsessive thoughts? Okay. Well, if you have compulsions comes with the actual thought. But you can have the thoughts without the actions. But you cannot have the actions without the thought. Makes sense, right? Okay. So, ask yourself, are you OCD? Al, are you OCD?
I don't know.
Am I OCD?
Probably.
Well, I have some forms of it, but it's not to the extent that my life is going to stop if it doesn't happen. And I always give this analogy, like, I like my towels folded a certain way. And if they're not folded the same way, I'm going to have a really hard time. So I will go to people's house and their towels will be folded up all kinds of ways, and I find myself, putting their stuff in order, and I had to check myself, like, this is not your house, it's not your stuff. Leave people's stuff alone. Maybe they like it like this. So, I'm not going to tell you that I stopped, because I'd be lying. Okay, a person that has OCD, they may end up being like, so annoying to you, because they'll come and say stuff like, well, why is that right there? Why is this not in order? If you want to see a good example of it, try looking at The Good Doctor. And Sean, which he has, is autism. And I mean severe autism. So, but he's a doctor. But he is so meticulous. He likes everything the same way all the time. Now that's cool for him. But people that have to live around him and work around him, it's not so cool for them because they hate it. He doesn't have a lot of friends. Sure, you can understand why. All right, so we're going to talk about post-traumatic stress. Post-traumatic stress is characterized by haunting memories, nightmares, social withdrawal, jumpy, anxiety, and insomnia. And this has to persist for at least 4 weeks or more following a traumatic experience. Now, most people really pair up PTSD with military combat veterans. But it goes further than that. Individuals that may have been in a disaster, something like Katrina or Harvey, any of those type of things, people have been under like extreme stress. So without getting the necessary help, it becomes diagnosable. And life for them begins to be kind of cut off from everybody else because they're trying to avoid those unwanted feelings and thoughts. So we watch TV a lot and we know about a lot of the mass shootings and things like that, and that a lot of them are former military. That happens. But that also happens because of the type of trauma they experienced almost on a daily basis, and then coming back to the States where everybody assumed that they should go back to being normal. So being in the civilian sector hurts them more once they get out of the military. While they're in the military, some of them are okay. But when they get out is when a lot of this really goes into effect. But a person that's been raped, molested, any of those things could actually cause PTSD. So we're going to move on. And I will tell that if any of you think that you may have this, the best thing that you can do is seek help. So we're going to look at dissociative and personality disorders. Dissociative identity disorders is DID. And back in the day it was called multiple personalities. And that's where an individual has multiple sides of themselves that have different names. Let's say me. Well, Terry would branch off into a little girl that's 5 years old, could branch off to a man that's 100 years old. It could branch off to a heterosexual. It could branch off to a homosexual. And these are the different personalities that will come out. But it will still look like me. And normally what causes dissociative identity disorder is when an individual has been traumatized. And I mean not just exposed to something, I mean extended period of abuse. Kids may have been locked up in closets or locked in the basement or tied up, or whatever it is something that has occurred for a long period of time. So they have no coping skills. So the other personalities come out to protect the host. So the moment that a person branches off, one would ask, well, how do they know they need help if they pretty much don't know that they're branching off? Well, they have blackouts. And when those blackouts occur, that means one of the personalities have taken over and the host now lies dormant. So this is probably one of the hardest disorders for a therapist to actually work with. Why? Because think about it. How do you know how many personalities are there? And if you don't know how many are there, how do you know you've incorporated all of them? And what a therapist's job is literally to introduce the host to each one of those personalities. And each one of them have a story as to why they are that personality, whatever it is. It could be a softer side. That might be the 5-year-old. It could be the maybe 20, 30-year-old. I'm a female, so let's say it's a male. And that male comes out to protect me from whatever anxiety I'm feeling. So what a therapist will have to do is introduce each of these personalities to the host to incorporate them back into them. Now, I'll be honest, that's one of them things I've never worked with. Because to me, you need to be specialized in that one. You might be able to diagnose it, but you probably shouldn't be the one working with them unless you have had extensive training. So, let's move on to, well, there are numerous amounts of personality disorders, and we're only going to go over one. If you want to know more, please do your reading. But we're going to talk about antisocial personality disorder. This disorder is a disorder that where the person lacks any conscience or of any wrongdoing. They have no remorse. They can be aggressive and ruthless. They can be clever. They can be con artists. And what it showed, they did brain scans of murderers with this disorder. And what they found was, what they found in this was that these individuals revealed reduced activity within the frontal lobe. And then it's also said that there could be a genetic predisposition, which means by interacting with the environmental influences, it actually can produce this disorder. So what it means is that there is a genetic trait that exists, but also the lifestyle that this child is exposed to as they're growing up can actually be a sign of it. Now, children can be diagnosed with something that is very much the same patterns of behavior. However, it is not called antisocial personality disorder. It's called conduct disorder in children. Only an 18-year-old and above can be diagnosed with antisocial personality disorder. A child is diagnosed with conduct disorder. Conduct disorder is not a good thing. I mean, it's one of those things that a kid could do something to hurt you. Don't even think twice about it. So, we're going to move on to mood disorders. And this will be the last of what we're going to discuss for this. A mood disorder is characterized by emotional extremes. So you have major depressive disorder. Major depressive disorder actually, it descends for weeks or months, where a person can go into being very, very unhappy. They can be lethargic, feelings of worthlessness, before they actually rebound into normality. Poor appetite, insomnia, and loss of interest in family, friends, and activities are often other important symptoms of this disorder. Major depressive disorder is also genetic. That's one of those that if a family member has it, and I mean a close family member, a mother, father, grandfather, grandmother, that's a dynamic genetic line. There is a possibility that it could occur. So you have to know your family history to know that if you would be one that this may happen to. So it'd be important for you to know that. I don't know about the the DNA testing or stuff, but I do know that you need to sit down and have conversations with your family members. Then we have bipolar. Bipolar disorder is really what it is. Like, you have two polars. You have North Pole, South Pole. And on the North Pole, it's the mania side. Mania is you're all over the place. Your mind is constantly racing. You don't sit down. You don't sleep. You do things in this stage that you would not normally do. And I mean, I've seen an individual actually become very, very, very promiscuous, ended up getting pregnant. And what was really sad about all of that is she had the potential of being in the WNBA. She was an awesome basketball player. She was predisposed, but she didn't know her family history. She went to a club. We were in California. So she went to a club in Palm Springs. Someone slipped something in her drink. And from that day to this day, she's not really recovered. She'll take her medication and then she won't. In the days that she doesn't, the more the medicine comes out of her body, the more manic she becomes, or the more depressed she becomes, which is this side of it. So when a person is on this side, a lot of what they did on this side, they feel guilty for. So they become very depressed to the point of suicide. So bipolar, actually, those individuals can actually have a pretty normal life if they stay on their medication. The medication literally levels off their brain waves, their brain activity, and the functions within the brain. And without the medicine, they're all over the place. To me, those are one of the hardest groups to work with. Why? Because when they on the medicine and they feeling good, they actually think they don't need it. They think they could get off the medicine. A lot of them will say, I've been delivered. I believe that, I honestly believe that God can deliver us from any and everything that we're going through. But He also gives us common sense. If you're diagnosed with it, continue to take your medicine. It could be life or death. So, schizophrenia, and a lot of people confuse schizophrenia with DID. Now, the two are not the same. DID are splits from the personality. Schizophrenia is the person hears voices. So if I asked you this question, do you hear voices in your head? Or do you hear voices like I'm talking to you? Well, if you say in your head, then in your head are your thoughts. If you hear voices like you hear me speaking to you, that would be considered schizophrenia. It's the outside voices. Now, with that particular disorder, it's dangerous because the voices normally tell them to do horrible things. I knew someone where the voices told them to burn down the house. They burned down the house. So, this is one that's also, believe it or not, it is hereditary. And it comes with delusions, paranoia, all types of different things that can come with it. It can be chronic in nature, which means that person more than likely will have to be institutionalized. It is one of those that's sad to watch. But it too can be monitored and you can have somewhat of a normal life. You have to take your medicine. Again, know your family history. Because those disorders that are what's the word I'm looking for? Genetic in nature, you need to know that. Because there's certain things that could bring it on. You could be predisposed because of family genes, but it doesn't necessarily mean that you're going to get it. It does mean that you need to be aware of it, and you need to know what to do to not become a full-blown whatever. So what that means is, don't drink from that communal punch bowl we talked about when we was talking about that chapter. Make sure you know what's going in, what you put in your mouth, because that sometimes will trigger something that's already embedded in you. So there, you need to be careful. Last thing, these are the rates of psychological disorders. Studies suggest that about 1 in 7 people have suffered from a psychological disorder during the prior year. The 3 most common disorders in the United States are phobias, alcohol abuse, and mood disorders. Here's a note for your test. The common cold of psychological disorders is depression. What does that mean exactly? There's something may happen in your life where someone could die, someone break up with you, something like that, and you'll feel down, you're going to feel depressed. It's the common cold of psychological disorders. It doesn't necessarily mean that now you're going to be diagnosed. It just means you're having a bad time in your life, and you need to process those feelings so you can move on. Okay, in the 21st century, the World Health Organization study of 20 countries found that the lowest rate of reported mental disorders was in Shanghai. The highest rate was in the United States. I bet you already knew that. One predictor of mental health is poverty. Although the stresses and the demoralization of poverty can perpetuate disorders, especially depression in women and substance abuse in men. Some disorders such as schizophrenia can also lead to poverty. Normally, schizophrenics live on the street. They can't hold a job. As a matter of fact, you would be afraid to be around them. I had one in my class many years ago. He used to walk around campus and he would talk to himself. He would be loud and laugh and all of those things. And I think I was teaching abnormal psych, and the young man came to class when we were talking about it. And he said he thought he had, I want to say he said mental telepathy or something like that. And I was like, well, no, baby, that's not what you have. You actually have schizophrenia. And I knew his uncle also worked in the department. And I told his uncle, and I think he taught sociology or psychology. I can't really remember, but he was in our department. And he said, well, no, he's going to be all right. I'm like, you're trained, you know better. He has problems. Students on campus are afraid when he comes around because his outbursts are loud. Like he be having a whole conversation, not a conversation, it's an argument. So I'm pretty certain if they did not get him the help that he needed, he would be homeless. So that's how poverty sets in. It's not necessarily that they end up on the street because, I don't know, nobody wanted to help them. No, they really ended up on the street because they really didn't know how to handle the disorder, and they would not follow medical advice. So I'm going to put in Jigs. Just put in for me a summary of today's lesson. Any questions that you have, make sure you reach out and ask, and we'll be able to get those answered for you. And I'm actually, this is the end of this, but I'm hoping that you got something from it. Next week, I'm going to send you one that's going to deal just a little touch on what therapy is And then the final one would be on social psychology. And then we're done. It'll be finals. So, guys, I hope that you enjoy your Thanksgiving and that you guys be safe when you go home. And make sure that your beacons of life are light in your communities. Maybe you can mentor a child and help them get to where you are. Guys, have a wonderful and safe holiday. You'll get another message from me for your next video. Take care.